Hello, everyone. Welcome to another episode of Retina Roundup. I am Dr. Renu M, Fellow in Vitro Retina and Ocular Oncology. I'm going to take you through this month's top articles. Starting with the first article, the title read High Dose Intravitreal Topotecan for Recurrent Retinoblastoma, Subretinal Seeds, and Vitreous Seeds. The purpose of the study was to evaluate the efficacy and safety of high dose intravitreal topotecan for recurrent retinoblastoma. There were 13 patients who were included in this study with recurrent retinoblastoma who were treated with high dose intravitreal topotecan at a dose of 90 microgram per 0.18 cc to 100 microgram per 0.2 cc. The primary outcome measures were tumor control, globe salvage, and treatment complications. They found out that at the first date seen, the median age of the patient was 9 months and the affected eye was classified based on the International Classification of Retinoblastoma into Group B in 2 patients, that is 15%, Group C in 3 patients, or Group D in 62%, that is 8 patients, with initial therapy of intravenous chemotherapy in 9 patients or intra-arterial chemotherapy in 4 patients. Recurrent tumor was detected at a median of 10 months as solid tumor in 3 patients, subretinal seeds in 10 patients, and vitreous seeds in 3 patients, and a high-dose intravitreal topotecan, that is median 3 injections at monthly intervals, were delivered. Additional chemotherapy was delivered by intra-arterial in 8, that is 62%, or intravenous in 1, that is 8%, and 1 eye received additional chemotherapy. In 3 cases, that is 23%, there was no additional therapy. At mean follow-up of 9 months, there was regression of solid tumor, subretinal seeds, and vitreous seeds, which was achieved in 12 cases, that is 92%, and globe salvage was achieved in all cases, that is 100% cases. Of those 3 eyes treated with high-dose intravitreal topotecan alone, tumor control was initially achieved in all cases, but one case that previously demonstrated massive vitreous seeding showed late recurrence of a solitary vitreous seed at 8 months. However, there were no complications that were noted. Thus, they concluded that high-dose intravitreal topotecan is an effective and safe therapy for recurrent retinoblastoma in conjunction with other therapy and possibly can also be used as a standalone therapy. Moving on to the next article. This study was conducted to evaluate the tangential retinal displacement occurring following macular hole surgery and to assess the impact of the internal limiting membrane peeling size on the extent of the retinal movement. This was a retrospective study which included patients with full thickness macular hole undergoing 25 gauge PPV with ILM peeling, patient who received either a small ILM peeling with a size of 2 disc diameters or a large peel which extended up to the arcades were included. Near-infrared retinal imaging was performed with spectralis before and 6 months after the surgery. The tangential retinal displacement was evaluated comparing the optical flow of the near-infrared images with a custom digital image analysis algorithm. They found out that 44 eyes of 44 patients undergoing PPV with small or large ILM peeling, small in 24 and large in 20 patients, were included. An overall displacement of 31.3 micron towards the optic disc was observed after the surgery. Large ILM peeling was associated with a significantly higher overall displacement in the central 4 mm and displacement in the outer 8 mm ring. Macular hole closure rates was achieved in 100% of the large peel group and 83.3% in the small peel group respectively. Thus, they concluded that PPV with ILM peeling for macular hole results in a tangential retinal displacement towards the optic disc. A larger extent of the ILM peel leads to a greater tangential movement, possibly improving the macular hole closure rates. Moving on to the third article. This study was done to compare the clinical characteristics, risk factors, and OCT findings in patients with central serous chorioretinopathy with and without bacillary layer detachment, henceforth called as Ballard, and to identify the distinguishing features and associated conditions of CSE with Ballard. This observational retrospective multi-center case control study collected data from 12 retina centers worldwide on patients with CSE from December 1, 2022 to April 1, 2023. CSE was defined by the serous retinal detachment and fluid leakage through the retinal pigment epithelium. Patients underwent detailed evaluations including OCT and were classified to acute or chronic CSE. Inclusion criteria included a CSE diagnosis with RPE leakage Ballard confirmed by 3 authors. aged over 18, and a detailed medical history from the 30 days before the symptom onset. The study assessed visual acuity, choroidal thickness, psychiatric disorders, corticosteroid use, prior CSC treatments, and hyperreflective material on OCT. They found out that 37 patients had CSC and Ballard and were followed for a mean of 4.92 months. The control group was comprised of 40 patients with CSC without Ballard. On clinical examination, Ballard was found as a circular yellowish macular lesion. On OCT, it was a detachment of the ellipsoid zone with splitting of the photoreceptor inner segment. It was associated with psychiatric disorders, use of corticosteroids, previous treatment for CSC, and also a thickened choroid. Thus, they concluded that Ballard in CSC differs from a typical CSC due to the presence of a circular yellowish macular lesion, detachment of the ellipsoid zone, segmentation of the inner segment of the photoreceptor, a thicker choroid, the use of corticosteroids, and generally it's more aggressive than the previous treatments. These results suggest that Ballard may serve as a valuable biomarker for the severity of CSC and highlight the influence of inflammation and previous treatments. Moving on to the next article. This study was conducted to assess the efficacy and safety of 0.19 mg fluocinolone acetonide intravitreal implant or ILUVIEN in treating chronic post-operative CME after pars plana vitrectomy. Patients with chronic post-operative CME who underwent vitrectomy in tertiary care centers in France were included in this study, and detailed review of the charts and OCT scans were done. The primary endpoints were BCVA and central retinal thickness. Secondary endpoints were the intraocular pressure, proportion of patients maintaining a BCVA of more than or equal to 20 by 40, need for additional treatment, differences between eyes that underwent a single and multiple surgeries, and OCT biomarkers of better BCVA. They found out that 49 eyes of 49 patients with a mean follow-up of 24 months were included. The mean BCVA increased from 0.40 log MAR at a baseline to 0.32 log MAR at 24 months follow-up. The mean central retinal thickness decreased from 409 microns at baseline to 340 microns at 2 years follow-up. The mean intraocular pressure was 14 plus or minus 4 mm mercury at baseline, and that remained stable at 14.03 plus or minus 4.1 mm mercury at 2 years follow-up. During the follow-up, the IOP exceeded 21 mm in 9 eyes, with one eye requiring cyclophotocoagulation. The BCVA was more than or equal to 20 by 40 in 47% eyes at baseline and in 58% of the eyes at 2 years follow-up. At month 18, the likelihood of achieving a BCVA more than or equal to 20 by 40 was higher in eyes with intact external limiting membrane and ellipsoid zone. Additional dexamethasone implant was injected in 14 eyes, that is 28.6%. Thus, they concluded that fluocinolone acetonide implant improved the BCVA, reduced the central retinal thickness, and allowed reducing treatment burden in eyes with chronic post-operative CME after vitrectomy. And they also further went ahead to say that the safety profile was acceptable. Moving on to the fifth article, the title read, Targeting the Tie2 receptor with faricimab in central serous chorioretinopathy, a case series motivated by a genetic finding. This study was conducted to investigate the effects of faricimab, a bispecific antibody targeting VEGF and Ang2 in patients with CSE based on a recent genetic study that implicated Tie2 signaling in CSE pathophysiology. This was a retrospective interventional multi-center case series. They included patients with chronic CSE who received at least one faricimab 6 mg injection between Jan 1, 2022 and April 1, 2024. Study sites included Massachusetts Eye and Ear and University of California, San Francisco. Patients with evidence of a CNVM on color photos, OCT, or FFA were excluded. 16 eyes met the inclusion criteria. The median CMT, or the central macular thickness at each visit from 52 weeks before to 52 weeks after the first faricimab injection was calculated using the automated Heidelberg Spectralis ETDRS subfield measurements. They found out that prior to treatment with faricimab, CSE had been diagnosed at a median of 4.1 years earlier, and SRF had been continuously present for a median of 30 weeks. Decrease in macular thickness was observed in 14 out of 16 eyes after the first faricimab injection and in 14 out of the 16 eyes in the follow-up period compared with the prior, 10 of which experienced complete resolution of SRF following the start of first series of injection at a median of 4 weeks. One eye worsened after the second injection. The median improvement in macular thickness was 40 microns. Upon review of the OCT images, reductions in the macular thickness were consistent with reduction in SRF or IRF. Visual acuity improved by 2 lines or more in 6 out of the 16 eyes. Thus, they concluded that they observed improvement in macular thickness after an intravitreal faricimab. Moving on to the sixth article. The title read Meniscus micropion, an ophthalmoscopic sign possibly associated with epiretinal proliferation after retinal surgery with gas tamponade. The purpose of this study was to describe an ophthalmoscopic sign termed a meniscus micropion and its possible association with proliferative vitreoretinopathy or an epiretinal membrane formation after retinal surgery with gas tamponade. Patients with intravitreal gas tamponade were examined post-operatively by one of the 6 VR surgeons from 4 different institutions. A micropion was defined as a white, yellow, solid appearing consolidation along the meniscus or the fluid gas interface. A micropion was visualized and photographed in 49 patients who received intravitreal gas. Preoperatively, retinal breaks were present in all 49 eyes, and a recmitogenous RD was there in 45, that is 92% of the eyes. Postoperatively, 39 eyes or 80% developed epiretinal proliferation. 16 eyes developed recurrent recmitogenous retinal detachment from PVR. 6 eyes redetached without a frank PVR. 9 eyes developed post-operative ERM or worsening, and 8 eyes had post-operative ERM, but there was no pre-operative evidence to determine if the post-operative ERM was new or a worsening of the previously present ERM. The single operation anatomical success in eyes with a micropion was 51%, which was lower than that of a contemporaneous recmitogenous RD control group in which no micropion was detected. In 2 patients, micropion were biopsied during the PPV and examined histopathologically, and they found out to be consisting of WBCs. Thus, they concluded that the meniscus micropion is an ophthalmoscopic sign that can occur after retinal surgery with gas tamponade. Features that distinguish a micropion from a post-vitrectomy fibrin or fibrinoid syndrome include delayed appearance, hyperautofluorescence, absence of translucent strand or sheets in the anterior chamber or the vitreous cavity, and the histopathological identification of the WBCs. A clinically detectable micropion may be a biomarker of PVR or an ERM formation. Moving on to the seventh article, the title read Safety and Efficacy of Human Amniotic Membrane Blood Transplantation in Cases of Macular Hole, a scoping review. In this scoping review, they aimed to systematically narrate the literature to identify cases of macular holes that are managed using human amniotic membrane and explore the visual and anatomical outcomes to inform the future research questions. A detailed database search strategy was developed to identify the English language published articles that reported human amniotic membrane to manage macular holes. All human clinical studies were included for a narrative data synthesis divided across the study groups. The database search identified 82 articles, of which 34 were eligible for full text review, 12 non-RCTs, 10 retrospective reviews, 10 published case reports, and 2 clinical trial registries. The non-RCTs included patients with macular holes related to a wide range of retinal diseases, including RD, recurrent holes, and high myopia. Only 2 non-RCTs reported comparative data with a control group, but the study characteristics differed and quantitative synthesis was impossible. Most retrospective interventional CDs and individual case reports reported a success rate of 93 to 100% in hole closure and improvement in BCVA. None of the studies reported adverse effects after a human amniotic membrane transplantation. Thus, they concluded that the human amniotic membrane effectively seals macular holes without any safety concerns, improving anatomical and visual outcomes in all macular holes. Moving on to the last and final article of this month's Retina Roundup. The title read Cystoid Macular Edema After Flanged Intraocular Lens Scleral Fixation Using the Yamane Technique, a multi-center cohort study. This retrospective observational multi-center cohort study compared the rate of post-operative CME between two IOL scleral fixation techniques. In this study, a flanged IOL fixation technique, Yamane technique, and a sutured IOL transscleral fixation technique, or the conventional technique, were compared. The study included 207 eyes with postoperative CMA that had undergone SFIOL and were observed for more than 12 weeks between Jan 2019 and Jan 2021. The primary endpoint was a comparison of the rate of post-operative CME at 3 months between the groups. Secondary endpoints were a comparison of post-operative BCVA at 3 months between groups and an analysis of the characteristics associated with post-operative CME in Yamane technique group. They found out that the Yamane technique group developed post-operative CME in 13% of the eyes at 3 months, compared with 1.9% in the conventional technique group. Postoperative BCVA was consistently significantly higher in the Yamane technique group. Thus, they concluded that although many retinal surgeons have performed the Yamane technique because of its convenience for SFIOL, their findings suggested that the Yamane technique carries an increased risk of postoperative CME compared with the conventional suture method. Therefore, a careful management of the postoperative CME is needed for SFIOL. Thank you.